Dr. Olubumi Aribisano, who represented the Permanent Secretary of the Federal Ministry of Health, and also you listen to Dr. Alex Gasasiri, WHO representatives, all to commemorate this year's International Day Against Drug Abuse and Illicit Trafficking. And that already gave you a clue into what we are talking about today on Health Matters. Good afternoon, wherever you're listening. My name is Bolanle Akoni, and I welcome you to another edition on Health Matters, where we talk everything and anything health. And today we are going to be taking a look at drug abuse crisis. What exactly is going on? Because you will agree with me that this drug abuse thing is not just particular to one person or particular to one region or something. It is all over the place. You go on social media, you see different things, different reaction, different body type to reacting to drugs, and you hear, okay, this person took this thing, that's why they're reacting like this. So it is high time we talked about it. It is high time we address it. And every year, a day is set aside to this effect, and that's June 26th. It's set aside to commemorate, to create awareness about drug abuse, just so that we can know we can choose better, we can live healthier, we can do right by ourselves. So like I said, every June 26th is a day set aside, and each year comes with a theme. And this year's theme says we should break the cycle, stop organized crime, and this is also calling for long-term action and reform to this effect. And on that note, I have personnel in the house. They are representatives of ISSUP. They are here to talk to us about this drug abuse crisis. And if you're wondering what is ISSUP, let me go straight to it. Or should I leave them to that so they can do it themselves? Oh, well, I already introduced them, so let me just go straight to it. ISSUP is International Society of Substance Use Professionals, or your state chapter. So they're here with us this afternoon. We're going to discuss about this drug abuse crisis. Without wasting time, before I get right into it, remember that we're streaming live on Facebook. The handle on Facebook is Success FM Live. And you already heard what we're talking about this afternoon. You would agree with me that it's everywhere. As we are talking right now, around you, around the corner, there is somebody or there is an indication of what we're talking about. So if you have any question already, you can be dropping them on Facebook. We're going to respond to it during the course of the show. Eka Soni bi Google Setting Lanfani àti gbọ́ ìkànnì Success 105.3 FM tó wà ní Mọ́kọ́lá nílùú Ìbàdàn. Ètò ìlera ṣe kókó náà ló ń bá fẹ́fẹ́ ṣọ̀rọ̀ lọ́wọ́lọ́wọ́ báyìí pẹ̀lú ọmọ yín olólùfẹ́ yín Bọ́láńlé Àkànní tẹ́túmọ̀ sí ṣúgà. Nǹkan tí a fẹ́ gbé yẹ̀wò lọ́sàn-án tòní òun ló kan gbogbo wa pátápátá. Tá bá ti ń bọ́rọ̀ lọ, ẹ̀yin náà ẹ máa mọ̀ pé lóòótọ́ kìíní ó kàn wá. Lọ́dọọdún a máa ń ṣe ayẹyẹ ọjọ́ ìgbógun ti lílo àti gbígbé oògùn olóró lágbàáyé. Nǹkan tá a fẹ́ sọ̀rọ̀ lé lórí lọ́sàn-án yìí òun ló dá lé lórí àwọn ewu àti àbùkù tí lílò àti gbígbé oògùn olóró tó ń fà sí àwùjọ wa. Àwọn akọ́ṣẹ́mọṣẹ́ ti wà ń kalẹ̀, ẹ ti mọ̀ pé gbogbo wa tí n bá ti ń ṣètò báyìí mi ń dá ṣe torí mi ìfẹ́ káwọn èèyàn máa ní ṣúgà ìwọ nìkan ló sọ báwo ni wọ́n náà ṣe mọ̀. Mo fẹ́ kẹ́ mọ̀ pé àwọn èèyàn tó mọ̀ nípa ẹ̀ náà máa ń bá wa dá sétò. Wọ́n dẹ̀ ti wà ń kalẹ̀ báyìí láti bá wa sọ̀rọ̀ lórí nǹkan tá a fẹ́ mẹ́nubà lọ́sàn-án yìí. Ẹ̀yin náà ẹ pín kárí kí gbogbo àwọn èèyàn lè láǹfààní ẹ̀. A wà lórí Facebook, Success FM Live ní lórí Facebook. Ẹ pín kí gbogbo àwọn èèyàn tí wọ́n gbọ́ lọ́wọ́lọ́wọ́ báyìí káwọn náà lè dé bá kán gbọ́ torí gẹ́gẹ́ bí mo ṣe sọ tẹ́lẹ̀ gbogbo wa pátápátá òun ló bá wí. Láì dènà pẹnu, ẹ jẹ́ kí n tètè bọ́ sí ọ̀dọ̀ àwọn àlejò wa torí mo lérò pé ọ̀rọ̀ tó pọ̀ la fẹ́ sọ̀rọ̀ lé lórí lọ́sàn-án yìí. Níwọ̀nba àgbà tí àkókò bá gbà wá dé, bẹ́ẹ̀ náà la ṣe máa sọ tó. Ẹ káàsán, ẹ̀yin àlejò wa, ẹ kọ́kọ́ kí wa ní tiwantiwa náà ká tó bọ́ sí èdè Gẹ̀ẹ́sì.
Ẹ káàsán, ẹ kú ilé. Wọ́n ní ẹ kú ilé làkàrà ilé, ẹ kú ọ̀nà làkàrà ọ̀nà. Akíyín lákọ̀lákọ̀.
Ẹ bá wa dárúkọ yín bẹ́ẹ̀.
Orúkọ tèmi ni Olusesan Samuel-Kayode.
Ẹ ṣeun.
Orúkọ tèmi ni Ìyáàfin Sanni Olúwarántí.
Orúkọ tèmi ni Ògúngbémiró George Tosin.
Ẹ ṣeun gan ni. That's it. You heard from the voices that I have in the studio with me this afternoon. And getting right into it, we want to talk about the drug abuse crisis. It's everywhere. Because I'll leave it to the professionals, right? I'll leave it to him to tell us. I'm going first to Mr. Olusesan Samuel-Kayode. How bad is this thing called this drug abuse crisis? How bad is it? Probably you should talk about some statistics from Nigeria or your state particularly. Would you want to help us with that?
Okay. Well, drug abuse is as old as human being, and if you look at different religious books, you will discover that the issue of abuse has been mentioned over and again. However, the issue of Nigeria is peculiar because this is our own country, this is our own land, and we are interested in it. A survey was carried out 2018, and the result says 14.3 million people have used drug in Nigeria, meaning 14.4% of the population has used drug. Now, in Oyo State has 23% in that same statistics, and so it calls for a period to look inward and see what we can do, and that is why a lot of organizations come together every June 26 to celebrate International Day Against Drug Abuse and Illicit Trafficking. And we didn't do anything out of the norm by not doing it. So that's why we have gone out to organize a rally today. We are here today to talk about also drug abuse, because it is what we should not push aside. Some years ago, we would have said, well, we are doing something, but we discovered that what we've done has really not had impact, so we need to do more.
From the clip we heard earlier, where Ms. Dr. Olubumi was addressing, she did say that the percentage of people that even turned up for this rehabilitation is quite small compared to what they are still looking at, and the amount of drug abuse cases that we still have right now. So yes, it is important that we talk about it, but let's break it down as it concerns us. Why? Kí nìdí táwọn èèyàn kan ṣe máa wà tó jẹ́ pé nǹkan tó máa rò pé àwọn fẹ́ ṣe ni káwọn bọ́ síbi àwọn oògùn yìí láti máa lò wọ́n? Kí lè àwọn nǹkan tó máa ń tì wọ́n sírò àwọn nǹkan báyìí?
Ní bí ọdún mélòó kan sẹ́yìn, wọ́n orí ètò móhùnmáwòrán kan wọ́n bi mí léèrè ìbéèrè náà. Mo sì sọ pé kò sí ẹnikẹ́ni tá a bí tí wọ́n bí pé bíbí tẹ́ a bí yìí o oògùn olóró ló wá lò láyé. Ìrìn àjò ayé ló ṣẹlẹ̀ sí. I mean, nobody was born a drug user, but life happened. Yeah. The truth is, there are no singular factor why a person would do drug, but there are so many factors that can lead a person to drug. And part of the factors has to do with DNA. When a person's father or mother or grandfather or grandparent use drug, there's a tendency that the person will use. There's the environmental factor, where you live, the environment you stay. If you stay among people who do drug, there is that tendency. There are so many factors that lead a person to drugs, and it would be unfair to just say, why will they go into drugs? So many things can lead to it, but until we dive into it, we may be judgmental until we go into it.
Okay, thank you very much. If you're just joining us, you're listening to All Matters on Success 105.3 FM, and we're talking about something that is very sensitive, that's drug abuse. I have personnel with me in the house already, and we have just gotten started. So if you are just coming, welcome on board. Remember, we're streaming live on Facebook. The handle on Facebook is Success FM Live. You can share it so other people get to benefit from it. And if you are already a part of us, you can drop your message already on Facebook. Anything at all that concerns this topic of discussion, you can drop it during the course of the show. We're going to address the questions. And it's your Basha Shendar Kwamwa Lori Koni Success 105.3 FM Lewa Bai, Eto Ilera Shikuko no Lengbo Lowo. Nikota den sọ̀rọ̀ lé lórí náà ni àwọn gbígbógun ti àṣìlò oògùn àbí àti gbígbé oògùn olóró, lílò àti gbígbé oògùn olóró, bẹ́ẹ̀ ni nǹkan tí à ń sọ̀rọ̀ lé lórí náà nìyẹn. Lè béèrè àwọn ìbéèrè yín àwa lórí ìkànnì Facebook Success FM Live. I'm down to be it was interesting. All right, thank you very much, Mr. Olusesan, for answering that. But then, how does this affect us? As let me say, since this is that matters, let me take it to the health part of it first before I extend it outwards. What can you say The question is open. Mr. Shoston, you can answer if you want. If you have answer to that, Madam Oluroti, you can also answer, as well as Mr. Ogungbemiro. How does this affect health? Let's start from there.
Okay, it affects health in the sense that there's so many aspects of it. For everyone that goes into substance use, there's what we call the tolerance. So what your body will take and what another person's body will take is quite different. And so the way the body will process it is quite different from one another. So some people come down with psychosis, some people come down with, personality disorder, behavior disorders that comes along with the use of substance. And substance is categorized into the following class. We have the hallucinogenic, which when used, they begin to see strange objects or things that is not seen by others. They start hearing voices that others are not hearing. We have the depressant. So when they take it, a person that is naturally active and lively becomes a bit dull and laid back. And then we have the stimulant that gets a person that is reserved to become a little bit high. And the implication of this is because it works with the brain, the central nervous system, and the brain is the coordinator of the whole body. So because it affects the brain, it affects every part, and it affects every organ of the body. And I need to put a caveat also, because as we speak of drug, we are also including alcohol. Because when we talk about drugs, a lot of people kind of leave alcohol out of it because it's socially accepted, but that doesn't mean, in fact, alcohol is dangerous than cocaine and heroin, because that is one of the substance that when you take affects from the crown of your head to the sole of your feet. So every part of your body. Somebody will tell you now that red wine is good for your heart, but it's dangerous for your head. Seriously. And research has shown now that alcohol is also a leading cause of cancer.
Okay, so it cuts across every part of it. Would you like to say anything before we say?
Yeah, again, when we are talking about the implication of substance abuse as related to the health matters, when someone engages in abusing the substance, the sense of judgment will be impaired in one way or the other. So, in fact, it can lead to a lot of things, like raping someone. So, accidentally, if such person have a sexual relationship with someone with HIV patient, that has already exposed the user to the disease, or someone that is that's having hepatitis B. So those are the risks that are involved in it. And again, drug abuse, it can facilitate mental health disorder.
Of course, we see that.
You see that previously is a lively person, just like Mr. Olusesan have said, and it will just increase the mood, increase the anxiety. It can even lead to depression. Based on the hallucination that it talks about, you just discover that this person begin to see color. I begin to hear color instead of seeing color, and it begin to do all sorts of things, maniac, and it can even aid bipolar disorder. So there are many health
suicidal thoughts, even suicidal attempts.
Exactly. So there are many implications of drug abuse as far as our health matter is concerned. Thank you very much.
Also, ní area health yẹn náà jẹ́ ń sọ ní Yorùbá fún àwọn ìyá wa àtàwọn bàbá wa ní inú ilé. Torí àwọn oògùn olóró tí à ń sọ yìí, wọ́n ní ewu púpọ̀ nínú àgọ́ ara wa. Ṣé mọ̀ pé ìtalárí ààrí inú, ọ̀pọ̀lọpọ̀ tó mu ògógóró, tó mu fònàgà, tó mu ṣẹ́pẹ̀, gbogbo ẹ̀bẹ̀ yẹn inú liver wọn, ẹ̀dọ̀ wọn àtẹ̀dọ̀fóró, ibẹ̀ ni àwọn oògùn yìí ló ń ṣe ìbàjẹ́ sí nínú àgọ́ ara. Tá bá wò láyé àtijọ́, kò sí nǹkan tó ń jẹ́ àrùn jẹjẹrẹ ṣùgbọ́n ọ̀pọ̀lọpọ̀ àwọn àṣìlò oògùn yìí àwọn ló ń fa àrùn jẹjẹrẹ. Then nípa gbígbọ́ ohùn, rírí àwọn ìyá àti bàbá tó ti kú látọjọ́ tó ti pẹ́, tó jẹ́ pé tán bá gbọ́ ohùn yẹn àbí tán bá rí àwọn àǹjọ̀nú tí ò yẹ kán rí tán fò láti òkè pẹ̀tẹ́sì sísàlẹ̀, táwọn ìyá wọn máa rò wípé bóyá oṣó àbí àjẹ́ ló ń ṣe wọn. Rárá, oògùn tí wọ́n lò yìí tó ti ní ipa lórí ọpọlọ wọn òun ló ń fà á. Ẹlòmíà ní ara ń ta àwọn, ara ń já àwọn jẹ. Òun lẹ ṣe máa rí nínú wọn tán bá ti gbé àwọn oògùn yẹn sí ara bírú kólòs tó ń sọ́nsìn, tẹ máa rí tán máa gbá orí wọn, Ibrahim ó yá jí padà, èmi wọn máa wọ́n omi lé wọn lórí. Àwọn ewu tó wà nínú àwọn oògùn olóró yìí òun náà ni ó fà á. Then mo tún fẹ́ fi ẹnu bà ibì kan nínú ọ̀rọ̀ ìlera wa tí à ń sọ, pàápàá ẹ̀yin ìyá ọlọ́jà tẹ̀ ń tajà káàkiri, tẹ máa dé àsáré bá mi lọ ọ̀dọ̀ ya Síkírà Àkàpọ̀, wọ́n á mú torí Mr. Olusesan wọ́n sọ̀rọ̀ nípa ògógóró, bọ́ kì í ṣògógóró nìkan, àwọn oògùn kan àtà máa ń pè ní over the counter drug, prescription drug, àwọn oògùn tó yẹ káwọn ìyá wa lọ sí hospital àbí ibi tí wọ́n ti ń ṣe àyẹ̀wò àwọn ènìyàn, wọn ò ní lọ. Àwọn tó ń ta lójú títì, torí irú gate láti ń bọ̀ bẹ́ẹ̀ yẹn sìn, àwọn kan ti wà ń bẹ̀ látàárọ̀ tó ti kó àwọn oògùn yìí sínú òrùn, àwọn míì gan ti melt. I'm talking about the over the counter drug now, the dispensing drug now, not the heroin or the cocaine. Ẹ wá lọ ra, even ẹ mọ̀ bóyá èmi gan ti expire. Then ibuprofen kìíní kan ẹ kó gbogbo àwọn oògùn ara ríro, and the same content náà dẹ̀ ló dẹ̀ wà nínú oògùn ẹyọ kan tẹ̀ ń lò yìí. Àwa di pé àwa di bárakú, wọ́n wá lo oògùn yẹn tán, kò ní wá ṣe iṣẹ́ tó yẹ kí wọ́n ṣe nínú ara wọn. So ara àwọn nǹkan báyìí la ṣe torí ẹ̀ wá wípé ó léwu fún àgọ́ ara.
Ẹ ṣeun gan ni Madam Oluranti, òun náà lẹ́yìn náà sì gbọ́ yẹn ẹ̀yin ará lé. Ẹ má gbàgbé pé ẹ wà lórí Facebook Success FM Live. Tẹ́ bá ní ìbéèrè kankan tẹ́ fẹ́ fi ṣọwọ́ sí wa, bóyá nǹkan kan wà tó rú yín lójú àti mẹ́nubà ni o, àbá àti ẹ̀tí mẹ́nubà ẹ lè béèrè lórí èpò Facebook Success FM Live. Àwọn ń tẹ̀síwájú ní báyìí. Kí wá ní nǹkan tí a lè ṣe gẹ́gẹ́ bí ayẹyẹ gbígbógun ti lílo àti gbígbé oògùn olóró ṣe wà? The team talks about breaking the cycle. So we want to look at it from the angle of the prevention, the treatment, if there is treatment, we're going to talk about it. The treatment, if there's treatment, we're talking about it, and also the recovery stage. So let's start from, okay, before I go there, you've talked about the health impact. Let's talk about the economic impact briefly, because there's something I would like you to mention. Let me see if you're going to mention it. The economic impact.
Well, the economic impact goes a little longer than we expect, because the summary of that is, if a person is on, let's say, 10,000 naira per month, and out of that 10,000 naira per month, 1,000 naira goes to the federal government, you know, or as its tax, and this same individual then goes into substance use and is no longer functional, because there are functional drug users and non-functional drug users. Now this person becomes, you know, not functional, and after a while is able to recruit 10 more people, and all of them becomes non-functional. You know, that means 10,000 naira is affected. That means the economy is affected by 10,000. You begin to wonder, it's just 10,000. That's just 10,000 naira in 10 places among people we know. Now imagine that same 10,000 going across board, you know, because people don't just live alone, we live like a social being, and the things start growing to 1,000 people, to 2,000 people, to 3,000 people. This affects the economy, because the money, the productive hour of that person, now we're even looking at the, what's it called, the tax that he's paying has been affected. Now the productive hour that he would have used to also add value, financial or, you know, service value, has been impaired. So we have to then start looking for someone to replace. And funny enough, sometimes it's hard to get people to quickly fit into that shoe. So there will be a lot of errors, trials, and freelancing. So it affects the economy. And the issue of also the amount spent on rehabilitation is also another. I think in Oyo State now, the least rehabilitation you can get per month is just, I think it's 500,000. The least you can get to rehabilitate a person for 1 month. And you can't even do 500 per month. You have to do about 700 for the first month because of some tests that will be carried out. Then subsequently can now be 500,000. Now look at that 500,000. If that 500,000 was used to do a business, that would have positively affected the economy. So these are part of how it affects the economy.
So just to add to the economic implication, I would like to go to another way just to answer this question. You can imagine what Boko Haram has cost us.
Thank you.
You can imagine what kidnapping has cost us. You can imagine what all these ritualists has cost us. The predisposing factors that aid in committing this crime is nothing but drug. Like Yoruba will say, Oju lasan will say, Gboma lowe ekuro. So before you can commit any crime, those àwọn kọlọrọnsí yẹn wọ́n á ti kọ́kọ́ gbé ara wọn gbóná. It's not easy to kill someone. It's not easy to put someone in inconvenient situation. So these people, they will need to take drug so that they can do their malpractices, and from there it is costing our nation a lot of money. And aside from that, we thank God for all the agencies that are doing well.
Even in the area of the kidnapper, they even ask for drug as in, what is it called now? Ransom. As ransom.
So, as I was saying, if we thank God for the agency that are combating this drug, I didn't be they are not there. You can imagine that no nation will come to Nigeria to do business here, because they will see us as a zone that is dangerous.
It exposes them to danger.
That will expose them to a lot of danger. So if we don't, and thank God for this year's topic that say we should break the chain. So in breaking the chain, then we are also liberating our economy and boosting it in one way or the other.
Okay, thank you very much. Quickly, let's move on. So what can we do? Kí la lè ṣe? Torí gbogbo ewu tó wà níbi lílo àti gbígbé ògùn olóró láti sọ yìí pẹ̀lú bó ṣe kàn wá láwùjọ ni àbí as individuals. So kí ni nǹkan tá lè ṣe? What can we do to prevent it? And I would like you to speak on Mr. Ogungbemiro.
Yeah, thank you very much. These are preventive measures. They are quite lengthy, and they are interwoven. The first thing is what we are doing now. Awareness. That is creating awareness. Yoruba will say kankan ni ranfa diti, so that people will know. Ke kuli ogbo ko de sọ fún toko wípé ipa kíní yìí ó ní ipa tí kò dáa ní àwùjọ wa. And I really want to talk about our schools, especially the teachers, putting this drug education into the curriculum, so that we will try and educate our kids right from we catch them young, so that they will understand the implication of this drug abuse and substance use disorder, so that they will just stay off from it. And another point is that it joined with the first one, strengthening individual resilience in terms of teaching them how to cope, the coping skill, teaching them self-awareness skill. In fact, teaching them the ability to say no.
Don't be influenced.
You know, some year upon year, people will just go out and they say no to drugs, say no to drugs. That alone is not enough. one need to be well educated and well prepared just to say no, because when you are caught to the corner, what are you going to say at that point? And I do tell the young ones that when they talk about this drug, you don't even stand there and be saying no, I will not take it. As you are saying no, you are reversing. You are reversing. As you are saying no, you've already turned back. As you are saying no, you are running away. Because if you stay there, you'll be saying no and you'll be participating. So we should teach them the resilience. We should boost their resilience. Another thing is family engagement.
That's important.
And it's very, very important because nowadays we are living in a very delicate family system, whereby parents, just because we are hustling and we just want to make the ends meet, we don't really have time for these children. And it's high time parents begin to look out for their children. Give them attention. Giving them attention is not even enough. Have a conversation with them. Know what they are passing through, and that alone is not still enough. Monitor them. Engagement is different from monitoring. So you need to just monitor them. Sometimes we just check their bags when they are not aware, when they are not aware of it. So check their school uniform pocket, check their bag, check everything, check their rooms, so that you'll be able to depict what they are doing. In fact, look at them physically, check their mental stability, check their physical outlook, so that you'll be able to know, is my child deviating from mental stability? Is my child okay or is not? So that's another point. And another thing is early intervention. As a parent, if you observe anything, once you see anything, say something. Seek for help. There are a lot of counseling units that you can go and seek for help. Seek for help. Let them, in fact, if you are suspecting anything, take them to a center, let them screen them, so that they will know whether there is substance in their system or not. So, and the last thing I want to talk about, just because of our time, is that there's something that we are doing now as a community, and it shows that we are part of the system that is aiding and abetting the people that depend on the drug. And what I want to talk about is we should reduce stigmatization. Nowadays, you just hear people calling people that are depend on drug, they will call them drug addicts. That word is derogatory. Omutini, Fagboni. That is not his name. The same way we cannot call someone that is battling with cancer only cancer. The same way we cannot call someone that is battling with diabetes only diabetes. So we shouldn't call them drug addicts. It's derogatory. These people, they need help. If we check it deep down, there is something that pushed them to whatsoever they are doing. And when they are alone, they are not happy. They really want to come out of what they are doing, but they can't because they are being captured. So in prevention, we need to reduce stigmatization. And after the reduction of stigmatization, our environment, we need to create a drug-free environment. If we see them, we have authority. If we see people that want to cause chaos into our environment by supplying all forms of drugs, illicit drug, we should report to the authority. We should create a drug-free environment. So that's all I just have to say for now. Thank you very much.
Thank you. That's all you have to say, but you have actually said a lot, and that's what this show is about. We will create awareness and also make people see ways they can go about preventing these things, because we preach prevention more than cure, because they say that's quite cheaper than cure, right?
Exactly.
So thank you very much. You've said that. But then I wanted to talk about treatments. If there is any form of treatment, so somebody that is listening right now that is going through that phase would know that, okay, you have talked about prevention, but I'm already there. So what can I do? So I would like Mr. Olusesan to quickly talk about that before we finally go to Madam Oluwarti on recovery. As fast as possible, please. Thank you.
All right. We have treatment, and treatment works. I know a lot of people want to ask the question: is it working? Treatment works.
Ìtọ́jú wà tó dẹ̀ ń ṣiṣẹ́.
Ìtọ́jú wà tó sì ń ṣiṣẹ́. Ṣùgbọ́n kan wà pẹ̀lú ẹ̀ torí ọ̀pọ̀lọpọ̀ ìgbà làwọn èèyàn ń gbé ọmọ wọn wá pé ẹ wá ṣe ìtọ́jú fún àwọn ọmọ yẹn. Wọ́n rò pé bóyá oògùn kankan wà mí kan tẹ́ máa fún wọn, tẹ́ bá ti fún wọn lò báyìí wọn lo oògùn olóró yẹn mọ́. Ṣé mọ̀ pé ìṣísẹ̀ntẹ̀lé ni wọ́n gbé kó tó di pé wọ́n débi tán dé. À ń láti tún lo ìgbésẹ̀ yẹn náà láti yí nǹkan padà. Ṣùgbọ́n ọ̀pọ̀lọpọ̀ ìgbà kan tó gbé wọn wá fún ìtọ́jú nǹkan ti yíwọ́, bóyá wọ́n ti ń rí ntí ò sí, wọ́n ti ń gbọ́ ohùn, wọ́n ti bẹ̀rẹ̀ sí ní ta nǹkan, wọ́n ti bẹ̀rẹ̀ sí ní ṣe àwọn hùwà tí wọn kì í hù tẹ́lẹ̀ tó ti ń di pé ó ti ń dààmú ọpọlọ kan tó gbé wọn wá. Torí ìgbà míì ọ̀pọ̀lọpọ̀ èèyàn wọ́n á ti rí pé nǹkan kan ti ń ṣe ọmọ ẹ̀, èyí tó yẹ kán lọ bá wọn tó yẹ kó ràn wọ́n lọ́wọ́, wọ́n lè gba ibi tí wọ́n lè lọ gba ilé orí òkè, wọ́n lè lọ sọ́dọ̀ àáfà yẹ̀míwò nǹkan tó rin gbogbo ẹ̀ tán. Mi sọ pé kò sí ọ̀nà bí àwọn tí mo dárúkọ yìí náà, ṣùgbọ́n ọ̀pọ̀ ìgbà làwọn èèyàn ò tiẹ̀ mọ̀ kí ni ìgbésẹ̀ tó yẹ kán gbé. Mo ti rẹ́ nìkan rí tó ti ṣe pé wọ́n lọ bá fún àdúrà ní ilé ìjọ, ó sì pè ẹjọ́ ẹni báyìí máa wá bá yín o, a ti gbàdúrà fún, ṣùgbọ́n ìṣiṣẹ́ ti ọ̀nà òyìnbó tó lóògùn òyìnbó ẹ fi ṣètọ́jú fún àwọn ìyẹn náà wà. Àwọn míì wà tó yẹ pé ọ̀rọ̀ nìkan ló kàn yẹ kó máa bá wọn sọ, ìtí à ń pè ní counseling. Ẹlòmíì ò tiẹ̀ nílò pé kán wọlé, bóyá ó ṣẹ̀ lò fúngbà àkọ́kọ́. Àwọn míì bóyá counseling náà ní, ẹlòmíì á lọ fún rehabilitation, ẹlòmíì dẹ̀ ní follow up after rehabilitation yẹn ló wà. Àwọn òbí àti alágbàtọ́ wọ́n ní ọ̀pọ̀ iṣẹ́ láti ṣe, torí àsìkò wa máa kàn dánú dúró bíi pé àwọn náà níṣẹ́ láti ṣe. Tá a bá ti parí ìtọ́jú wọn tán, tá a dá wọn padà sílé, ìgbésẹ̀ tó yẹ káwọn náà gbé, tó bá yẹ pé wọ́n gbé gbogbo nǹkan lọ ní àlàáfíà. Wọ́n lè padà síbẹ̀ mọ́. Ẹ ṣeun gan ni. A ní ìbéèrè lórí Facebook. Abdulrasheed Olawale says, well done. You talked about a people buying mixed up tablets, akakpo. Almost everyone in the society used to it. And what is making people do that is money, harsh behavior from some doctors and medical personnel. But I have some questions. What can you say about people consuming excessive cola nuts and bitter cola, chewing it raw, because they said that it consists of caffeine? That's one question. Then another one, what about herbs concoction, agbo? Is it good for treatment or what? There is one powder, alabukun. They said that it contains part of cocaine. Is it true? What about sniffing of one mixture, taba? Should I wait till you respond to that question before I proceed? Because this person still has further things. Okay, please go on.
Let's answer that one first. Yes, everybody are used to mixture of drugs, akakpo bí mo ṣe sọ lẹ́ẹ̀kan. Ṣùgbọ́n you have to make an informed choice about your own health, because Mr. A is taking different type of drug at the same time, or the same set of drug with the same content at the same time. For example, some people, even medical doctor can even prescribe paracetamol for some set of people, maybe twice daily or thrice daily, but they will tell you that 2 cap a tab cannot be enough to sustain them, to overcome their pain. Then they go ahead to take 6, which is self-medication. But if you are in love with your own health, abide by the prescription being given to you. If Dr. A is harsh to you, you can go to another hospital to meet Dr. B. Everyone cannot be harsh at the same time. And let us give it to our doctors. I heard the news few weeks ago that maybe a doctor to 5 general hospital. Oh no, lọ́mọ oníyàwó ńlé doctor náà ń sì kí ló dé irú doctor yẹn máa harsh torí kí ló dé fà economic tá à ń sọ lẹ́ẹ̀kan jápa or kí only doctor ẹyọ kọ̀ọ̀kan máa so torí ẹ̀ náà ni ìjọba ṣe fọwọ́ sí tí CPN fi fọwọ́ sí wípé kí pharmacy wà kí patent medicine store kó wà but you have to go with your prescription and don't go beyond the limit of the prescription. That is what we are talking. Don't do self-medication. It is dangerous for your health. Then for the herbs, well, kí aláyé tó dá bí wọ́n ṣe sọ lẹ́ẹ̀kan ó ní nǹkan kan náà táwọn bàbá wa ti fi ń tọ́jú ara wọn gẹ́gẹ́ bí àgbo ṣèbí ń gbà láyé ọjọ́ nǹkan wá tún dá orí wa kodò báyìí wọ́n á tún rọ àgbo yẹn sí wa nínú but the only area because èmi ò ń ṣe akọ́ṣẹ́mọṣẹ́ lórí ọ̀rọ̀ àgbo but nǹkan tí mo mọ̀ ni wípé the content anybody tó fẹ́ fún ẹ lágbo mu àbí tó ń sọ pé lo àgbo do you know what they bring together torí àgbo ìkan náà oògùn olóró tá à ń sọ tí wọ́n ń gbìn nílẹ̀ wa yìí tí gbogbo á mọ̀ sí igbó àti oríṣiríṣi orúkọ tó ń pè àwọn míì gan fi ń ṣe àgbo fún àwọn ènìyàn tó jẹ́ wípé ó ń fa àrùn tí ò yẹ kó fà nínú ọpọlọ so àwa ń rọ̀ yín wípé kẹ́ ẹ tó mu àgbo ṣé ẹ mọ nǹkan tán fi pilẹ̀ ṣe àgbo tí wọ́n ń fún yín mu then kí ni content abẹ́ that is òṣùwọ̀n àgbo tẹ́ ẹ mu.
Okay, the person continued by saying, are you doing a consistent enlightenment for drug abusers in prisons, in schools, higher institutions of learning and the like? What is your relationship with NDLA? Okay.
Well, we go around schools and prison. We go everywhere that we can do the talk, to do the sensitization, and our relationship with NDLA is cordial. We work together hand in hand because how do you intend to do a project without go with NDLA, without work with
they are the major stakeholders.
They are the major stakeholders. We work also. We have to work with NAFDAC also and work with NGOs. So everybody is a multi-sectoral approach that will put hands together in order to work.
To break the cycle, it's a multi-sectoral approach.
Yes, an holistic approach.
Okay, Madam Oluranti, so we want to talk about recovery. You mentioned a bit that I'd like you to progress on recovery. What are the stages? What are the things? Is the family, society, how can everybody join hands to break this cycle in the recovery stage?
Thanks so much. As he rightly said, recovery is a process of change. Is a process of change. Is a journey in well-being, in wellness. It's not a destination. But some people thought is a destination that once a child or a victim is being taken for rehab or for treatment, immediately they comes out, they believe it is over and they leave it to them. No, they need supportive care, family supportive. Yes, they need family supportive care. Even some parents, if they take their children to rehab, immediately they made that first payment he mentioned, they will abandon them. Even some will be begging you, we don't want them back home. No, you have to show them love. That's why we have something called family therapy. Yes, so in recovery, even we are not yet there in Nigeria. There is something we call halfway home. There's something we call recovery home. If a client is being discharged from treatment center or from rehabilitation center, that client is supposed to be enrolled into halfway home center or a recovery center, at least for another journey of 6 months. From there, that person goes to work, comes back, and be under supervision, as he said, monitoring, before that person can now be fully reintegrated back into the society. At that recovery stage, we have what we call anonymous people that have passed through treatment rehabilitation. They also come together to become an eagle eye on each other, because there is tendency of lapse and relapse, and when it comes, if it triggers, then the work of the rehab center or the treatment center will be needed at that particular hour. But it's the other way around in Nigeria. Immediately these clients are being discharged from rehab home or from treatment center, they enter back into the society. And one thing some will tell you, they don't even engage them before they leave treatment. You could have engaged them, you could have established something that they will do, because an idle hand is the devil workshop. So if you don't give them what to do in the area of economy, in the area of productivity, to keep them busy, there is tendency of going back again. Then there's another mistake that parents are making when it comes to recovery. Say, okay, say you want me to engage them, I'll change the environment. I tell you, if you rehabilitate somebody in Ibadan and you change the person to another state or another town, he will still know how to find his own people there. So it is better they are at your nose, so that you are in it together. You give them that full support they needed for that recovery until they get it right.
Success 105.3 FM láwa adé sọ̀rọ̀ nípa gbígbógun ti lílò àti gbígbé oògùn olóró. Àwọn akọ́ṣẹ́mọṣẹ́ tí ń bá wa sọ̀rọ̀ látẹ̀kọ́. Tẹ́ bá ní ìbéèrè kankan tẹ́ fẹ́ béèrè lórí nǹkan tá à ń sọ̀rọ̀ lé lórí, àwọn kan sì fi ṣọwọ́ sí wa lórí Facebook, ẹ̀yin náà lè pè wá wọlé sórí 0805 51053 or 0905 51053 0805 51053 or 0905 51053. Bóyá ìbéèrè yín papọ̀ mọ́ nǹkan tá à ń ṣe lọ́wọ́lọ́wọ́ báyìí o, àbí ó ní ṣe pẹ̀lú àti ìbẹnubá, ẹ lè pè wọlé kí àwọn akọ́ṣẹ́mọṣẹ́ bá yín dáhùn sí kí àtúkúrò lórí ètò. If you have any question concerning what we're talking about, you can call in on 0805 51053 or 0905 51053, so we can respond to your questions. Maybe we've mentioned something about what you want to ask about, or we haven't even talked about it. You can call in and ask your question, and you can still drop your questions on Facebook, Success FM Live on Facebook. Maya Kutifa, I see your comment. I appreciate you. Abdurrashid, okay, you're welcome. All right, rehabilitation. I want to talk about something that is very important. Okay, let's see who's here. Hello. 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 Can you hear me? Hello? Alright, please give us a call back. We cannot hear you. I don't know, maybe it's the reception at your end. Please give us a call back if you can. The number still remains the same. This rehabilitation that we're talking about. Hello? Hello? We're still having issues with this person. Alright, please, if you try the first number and probably we cannot hear you, you can try using the other line as well, because we cannot hear you and I can see the call is in. Is it cheap? Because some people, to even come out, they know that they are going through this phase, but they don't know how to come out, because they'll be like, manika lomu owo iyebiye kan wa bayi nisinyi ade mo bi ta ti boya kin kuku wa bayi abi boya ka ku je ko wa bayi tori alowo ta fe fi toju e. So what about the finance aspect of it?
Again, down to Yoruba, apati Yoruba, torí ibẹ̀ gan ni ìṣòro wà. Lóòótọ́ láyé àtijọ́ náà ní ojú mẹ́rin ló ń bímọ ọ̀pọ̀ ènìyàn, bọ́ kò rí bẹ́ẹ̀ mọ́ láyé òde òní, torí olúkálùkù ń de mọ́ra, olúkálùkù ń ro mọ́ra bí ìsẹ̀móni. Ṣùgbọ́n àwa wá ń sọ fún àwọn òbí nílé lóko báyìí wípé àyè ìtọ́jú ṣí sílẹ̀ tí ẹ bá ní àwọn ọmọ tó ní ìpèníjà.
Okay, sorry to cut in. Hello. Good afternoon. Yes, please. Okay. All right, thank you.
I just want to, in appreciation of what you are saying, I want to ask what is our government and traveling agency to all the boys in our various compounds in Ibadan now, which they smoke anytime you go there, think all these young men. The government are dedicating its resources in getting these people out of place. That's not a problem to the younger children who go to schools and see them smoking all the time. That's my question.
All right, thank you for your contribution. We appreciate you. Okay, so
Thanks so much, sir, for that question. You mentioned what is NDLA doing. We all see on news. If you go, maybe you Google NDLA weekly activities, you will see, and I don't think there is even a day there won't be a report from NDLA on the news about arrest and seizure made on daily basis. Likewise about the awareness program. But one thing is sure, as you are packing them, other people are converging. Like we ISSUP, we collaborate with what is it called, NDLA Oyo State Command. Last Wednesday they went out for their own rally. We joined them, and this morning too we were together at the gate park. One thing is that we cannot totally eradicate these ones out of the road. There's nothing we can do. But the only thing that the NDLA can do is that they keep on trying their best in the area of maybe the dealers, the peddlers, the traffickers. But the smokers, there's nothing we maybe ISSUP can do rather than to continue educating them. And those who are ready for counsel, yes, lest I forget, even the SFH, we were together this morning, they gave them counsel, and they also conducted a free test for them. We can't push them out of our society. And also parents too, when you have your children going to school, please, as Mr. Tosin say, let your eye be on your children.
observe.
Yes, it's very, very important. NDLA cannot do it alone. NGOs cannot do it alone.
The government cannot do it
alone.
I think
It's a concerted effort. Thank you.
like I said the other time, it's an intersectoral collaboration. Unfortunately, the communities sometimes put the blame on government. But like the wise man said, it is not what the government of your country will do for you, but what you will do for your country. What are we doing? If we see government is not working, that is why NGOs are formed, to bridge the gap where government is not working. And at the community level, there's no big deal in starting a community activity to engage some of these youth. Some of them are out there because there's no job. Government jobs are filled, private are filled. But if we form something at the community level that people can do, it will equally help.
All right, thank you very much for all the contributions, for listening. Our time is fast spent. This is all we want to draw the curtain. But before we do that, I'd like to get last words from my guest. So starting from Madam Oluwati.
Thanks so much. I want to take it from the aspect of the community and the family. The community should try as much as possible. As we open police posts, we too are the community center. We in the olden days, our parents used to have community grammar school, community whatever school. We can also have community rehabilitation center. We can, like in Lagos State, few months back, they've inculcated drug addiction center into their primary health care center. Oyo State too can do such. Now that there is on news that they are rehabilitating some of the health centers, so they can have a desk officer, they can have an addiction counselor. Yes, also in the school. Then the family should always monitor their children. They should start drug education from cradle, just as they do for sex education. Thank you.
Thank you very much, Madam Olorsi. All right,
Yeah.
Mr. Ogunpemiro.
As far as I'm concerned, what I would just say is that it's still bound down to parents, that parents should look out for their children. There are some parents that are covering their children. They know that their children are into this and they don't seek for help. I've seen a child that sent his parents packing, both the father and mother. He sent them packing, leave the house, I want to take charge. And he brought his friend into the house and they are enjoying themselves while he sent the parent out. You know, before it gets to that level, let us take charge. And I will still hand my own side from the point of stigmatization. It is very, very important. Even at the community level, we shouldn't stigmatize. These people need help. Let's help them. If you cannot talk to them, reach out to different places where they can get the help. Go to the hospital, go to UCH, go to NDLA office, make the report. Like the man that asked the question now, if you see that your environment is like, go, you can still make the report at the NDLA office. They are always proactive to help. Thank you very much.
All right, thank you very much, Mr. Olusesan. Just 1 minute because my time is gone.
If you need rehabilitation, just reach out to Bolanle. She will reach us.
Of course.
And also, please, media personnel, let us not glamorize drugs.
Thank you very much. All right, that's how we get to draw the curtain on today's episode of Health Matters. I believe that you've been able to pick it also from today's show. Thank you to my producer, Mr. Sheon Akonde. Thank you, Samuel, for being on social media. Thank you, Bats, for being my studio engineer. If you have anything you'd like to talk to me about, my number is 081 0396 2393. 081 0396 2393. Remember, your health is your wealth. Don't joke with it. Stay healthy, still strong at all times. It is bye for now.
This is Success 105.3 FM Ibadan, keeping you on top